Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about bunions and whether you should consider doing surgery or not. So the question is surgery recommended for a bunion? So reminder, a bunion is a prominence of the first metatarsal where the metatarsal turns out, toe turns in, you get a prominence, it starts to grow bigger, and it can actually be pretty painful, pretty problematic. And the question that people commonly ask is, should I do surgery? So there's two answers to this question, really. One is, just because you have a bunion does not mean you need to treat it, does not mean you need to do surgery on it. If you have no pain, have no discomfort, and the things that you're doing are enough, then you don't go ahead and treat it. You don't need to do surgery on it. And I recommend in most cases, if it doesn't interfere with life, don't do surgery on it. The answer number two is really comes down to the answer to those questions, and that's, does it hurt? Is it interfering with life? Is it affecting you? If that is the case, then surgery should be considered, should become part of your life. Because if you're finding that every single day you're having pain, if you're finding that you're consistently having limitations in what you're able to do, then yes, surgery should be considered, and truthfully is often recommended. If it's interfering with life, let's get your life back. The surgery is relatively easy and should be done. So over the next couple of days, we're going to talk about the different types of surgeries, the different things you can do, and what types of surgeries you consider. But really what it comes down to is, do you have any pain? If the answer is no, don't do surgery yet. Number two, is it interfering with life? So yes, I'm having pain, but it's not interfering with life. I still recommend you don't do surgery. So you're going to do surgery. I do recommend surgery if you have pain and it's interfering with your life. In those cases, then you should aggressively treat it. And by treating it, you can usually get your life back without pain and not have it limit your life any longer. It's a relatively easy surgery when it comes to surgery. So this is Dr. Brandt Gibson, and this is your Podiatry Tips Day 246. Bunion, is surgery recommended? In some case, it really